I'm Dr. Ray Mulry. What you're about to see is a nurse, busily involved in caring for others. You will participate step by step, learning how to care for others as you are learning how to care for yourself. It is no secret. Transfers are a major cause of back injuries for nurses. The good news is that most of these back injuries can be prevented. Throughout this program, you will observe the nurse as she continually makes use of the position of strength. You will observe how she maintains back straight, knees bent, stomach and thigh power as she keeps the weight close to her body. You will observe the nurse in the position of strength at all times throughout all of her activities. Most of all, you will see yourself as you participate in this self-help back injury prevention program. It is important to determine how much the other person can actually help. In this case, he is able to help somewhat. The bed is in the high position, which is correct. She faces his front before rolling him from one side of the bed to the other. This reduces how far she must reach out and away from her own body. She bends his knees to increase leverage. She lifts with one hand under his shoulders, with the other hand by his knees, and then rolls him onto his back. She tucks his arm under his body before rolling him again to his side. She completes the roll, so he is now on his other side facing the chair. She has one foot close to the bed, with the other foot slightly behind, and her feet are about shoulder width apart. Her back is straight. Her knees are bent. She is in the position of strength. Her chest is pushed forward, and her head is up, producing a straight back with a nice inward curve in her low back. It is sometimes helpful to place one knee on the bed to keep from reaching too far out over the bed. As always, it is important to push your chest forward, which helps you maintain the position of strength. Freedom from back pain means you must take advantage of the best techniques available for good back care. The position of strength is a basic posture of the time-honored athletic art form called karate. Notice how the karate instructor maintains a straight back and bent knees as he keeps his hands close to his body, just as you should anytime you are lifting a person or an object, whether at work or at home. Learn to use the position of strength throughout your activities of daily living. Remember, this applies to all of your activities throughout all of your working and leisure moments. Let's look further into this. As she prepares to transfer him from bed to chair, she needs to move him to the edge of the bed. She moves him by lifting with one hand under his shoulder while the other hand is guiding his legs. She is in the position of strength, and she is guiding his body weight so his weight works for her, not against her. As in every transfer, you have to determine how much help to expect. In this case, she will lift most of the weight by herself. The transfer belt is placed securely around his waist. He is at the edge of the bed. The chair is placed at his strong side. She is in front of him so she can block his foot and his knee. He holds onto her upper arms. He must not be allowed to grasp her neck or shoulders. This can cause a back injury. She is in the position of strength, which is the back straight, knees bent position. She takes hold of the transfer belt behind his back. She instructs him to lean forward and to push up with his legs. She leans back and helps him to the standing position. She always maintains the position of strength, and he is close to her body. She pivots in the position of strength and lowers him to the sitting position. Notice her straight back and bent knees. She can help tremendously in this situation by tightening her stomach muscles throughout the procedure. There are 4 basic steps in any transfer. They are: prepare the other person, prepare yourself, begin the transfer, complete the transfer. She prepares herself as she clears the way of obstacles near the bed and near the chair. She does a backward bend to be sure she will have a straight back with a nice inward curve in her low back when she makes the transfer. She talks with him. She lets him know they will be moving from the bed to the chair. She wants to be sure he assists during the transfer as much as possible. She makes sure his feet are directly under his knees. This is very important. She raises the bed so his feet are barely touching the floor. This makes it easier to straighten him because he is higher and closer to the standing position. He holds onto her arms just above and behind her elbows. She places her left foot forward and blocks his knees. She reaches under his armpit and grasps his shoulder blade, then places her right hand on his buttock. He leans forward and slowly rocks to begin the transfer. She brings him into an upright position and he carries his own weight. Pivoting in the position of strength, she transfers him to the chair. Because speed is important to an effective transfer, let's observe the transfer in real time. We will repeat the transfer several times so you can see how the para method and the position of strength flow together. The sling is in the right position when the top of the sling is at his shoulders and the bottom is just behind his knees. Elevate him to the proper height. Position and lock the chair properly. While one person supports him, the other manipulates the lift. And slowly lower him onto the chair. The most important point about mechanical lifting devices is use them when you need them. Of course, it does take more time, but remember, you are taking care of yourself as you are taking care of others. She has made sure his feet are well positioned on the footrests, and she is standing behind him in the position of strength. She grasps the transfer belt, pushes her chest forward, producing a straight back with her head up high, tightens her stomach muscles as she lifts with her legs. If the weight is too heavy, get some help. Protecting your own body is particularly important during these physically demanding activities. You may choose the transfer belt method or the para method. In this situation, we will use the para method. He holds onto her arms just above and behind her elbows. She places her left foot forward, preparing for the pivot. She blocks his knee and reaches under his armpit and places her right hand on his buttock. He leans forward and slowly rocks to begin the transfer. As they reach the upright position, she pivots in the position of strength and lowers him to the commode. In every transfer, take care of yourself and use the position of strength at all times. Let's watch the same procedure in slow motion as the transfer is made from the commode to the wheelchair. The procedure is exactly the same as before. He is close to the edge of the bed. Because the nurse and the assistant have to reach out and away from their body, they are particularly careful to be in the position of strength. Their palms are turned upward, allowing them to use the strong muscles on the inside of their arms. Back straight, knees bent, with their stomach muscles tightened, they complete the transfer as quickly as possible. One pulls in the position of strength and the other lifts in the position of strength. And they continue to use the position of strength even with one knee onto the bed. This transfer is made in several short lifts rather than in one big lift. She is standing at his weak side and is holding the transfer belt. As he falls, she goes with the fall, absorbing the fall in the position of strength. She uses back straight, knees bent, stomach and thigh power as she keeps his body close to hers. When they are both ready, she assists him to the standing position, always maintaining the position of strength. So that's the way it is. You will continually confront difficult and challenging tasks. Use the position of strength at all times. Take advantage of stomach and thigh power. Your power center is in the center of your body, and you can always take advantage of those strong stomach muscles even when you are caught off guard, just as the nurse might have been when he fell to the floor unexpectedly. Those unexpected situations are the most dangerous, and that is why you need to practice using the position of strength throughout your day, so it becomes a natural, everyday habit. Use the position of strength as a regular part of your daily life. It looks better, it gives you a more desirable and confident posture, it is safer, and you will be making a giant step toward freedom from back pain. Remember also, freedom from back pain means coping with stress and tension. Learn how to relax. Maintain a good stretching program. More than anything else, take care of yourself. I am tempted to say good luck, but as you know, there is little luck involved. You can do it, and that is what freedom from back pain is all about.